Definitely hiring a social media manager.
Okay.
It's a full-time job. Like for me, that was really difficult. I showed you my drawings from like elementary and junior high. You would laugh. No, I'm not very good. I'm not very good.
What keeps you going in aesthetics, right? What keeps you driven? What keeps you going? And I really just tell us about the whole journey. What's up, everybody? Cam Hemphill here, your host for Medical Millionaire. Hey, guys, thank you so much for taking the time to tune into the podcast. Our goal is to give incredible value and insight for practice owners. So if you're looking to open up a medical aesthetics practice, or you have one and you're looking to scale, every single one of these episodes that we bring to you, they're to help you take your practice to the next level. So I have an amazing guest on today, guys. She's out of South Florida. She's been in aesthetics for many years. She has an incredible journey, incredible story. And I want to welcome Yana Bromberg to the show. Yana,
Hey.
What's up? How are you?
Good. How are you?
Doing so good. I know that we've been trying to get this book for quite some time. You're super busy.
Yes. Thank you for having me finally.
Tell us about your journey. When we were talking offline, you have an incredible story. The audience needs to hear it. It needs to hear exactly how you are, where you're heading, but most importantly, what keeps you going in aesthetics, right? What keeps you driven? What keeps you going? And I really just tell us about the whole journey.
Oh boy, where do I start? Okay, so I always knew I wanted to practice medicine, right? So I went to PA school from New York, Toro School of Health Sciences. And when I graduated, I just, took the first job available. I was a hospitalist at Staten Island University Hospital. And then I got pregnant, had a baby, and I got a random text from a recruiter saying they're looking for someone to start working, like a block down from home. They needed Russian speaking. It fit right in. I was like, perfect, let's go. So when I started working there, it turned out it was actually a urology office specializing in sexual medicine, testosterone replacement therapy, erectile dysfunction, things of that nature. So this was totally out of the blue. I had no idea what I was doing, but whatever. The physician who I was working with at that time, so he's great. A little bit impulsive. He's a go-getter. Let's put it that way. Whatever he thinks of, he does it, and he does it right now. So one day I came to work, just an average day, and he just said, you know what, we're not doing this anymore. We're going to be a MedSpa. And it was just what? How do we go from looking at male genitals all day to injecting faces? It was just how are we doing this? Aesthetics was never something that I aspired to do, so it just kind of fell into my lap. He sent me to all these trainings. He bought every laser there was, and literally within a few weeks, we transformed from being a urology practice to MedSpa. And so thank you, Dr. M, but that's how I got into the field, and that was about 7 or 8 years ago.
Okay, so let's talk about that for a second, because everybody I have on here has a very unique story of how they got into aesthetics, right? And I do as well. Mine was very random. Had a buddy that bought a practice years ago, needed help marketing it. I come from that background, business process automation, marketing. So I got in through an interesting way as well. But hold on, I heard you say you went from literally urology to a couple weeks later, we're not doing this anymore. We're going to aesthetics. Mm-hmm. This interesting entrepreneur that you work with sounds like a guy that makes decisions, sees a vision, goes for it, invested a tremendous amount of cash and capital, and all of a sudden you guys became a med spa. And that was just exactly. One day you're, doing urology, the next day you're in aesthetics. So talk to us about that. Was that hard for you? Was it easy? Was it fun? Did you have no idea where you were going? Could you take him serious? I got so many questions.
At first, definitely was not taking it seriously. I thought, when you're coming from you're thinking about medicine, you don't exactly think of aesthetics, right? Mm-hmm. And things have changed a lot over the last decade, I would say. But back then I was really into, I don't know. I thought I envisioned myself working in a hospital for the rest of my life, And so when we started with the lasers, I was like, I almost felt like, what am I doing here? Like, are you sure that, I'm the right person for the job? But then as I learned more about it and I started going to all of these trainings and advanced trainings and the amount of knowledge you really need, it really is an art. It became fun and I loved it. And it doesn't feel like work. It's something that I love doing, and I don't know. It's been amazing. The whole journey's been amazing. But yes, definitely a learning curve going from just doing, you're being a hospitalist or whatever, or focusing on one specialty, and then going into aesthetics. It's very different, but I wouldn't change.
So okay. So a big part of your why and maybe purpose of keeping, going, because I know that days can be challenging, days can be difficult, but it sounds like the patient journey from, let's call it urology. I would call that like clinical, probably, insurance-based pay, probably the very similar like day-to-day objectives that you would do, right? You kind of anticipate what your day is going to look like, patient experience, those types of things. So moving into the aesthetics space and you kind of being like, this was thrown on your plate, on your lap, if you will, figure it out. And then you went through the training. Are you saying that you love that process now of connecting with the patient journey, seeing the outcome and looking at it through an artistic lens?
Yeah, for sure. It's so satisfying because you do get to put a little bit more of a spin on treatments, I guess. There's like the art behind it. You get to personalize things more. When you're doing, let's say, basic urology, you're treating prostate cancer, kidney cancer, there's more or less kind of like a protocol or an algorithm we follow.
Yeah.
We don't dictate the treatments. Other institutions tell us what's the right thing to do step by step. Here, you're looking at someone's face and you can, you see how they move, the dynamic of the muscles and everything. You can personalize the treatment. You can discuss it with the patient of like, what are you looking for? What are your goals? And then based on that, you can already,
So instead of having like this like, I don't know, I don't want to call urology mundane because there's a place where I totally get it. Hopefully I never have to go to one. But like what you're saying is there's a protocol, right? Like some of these clinical based strict, environments come from the top down. Here's the protocol. Here's the procedure. Here's what you do when this takes place. Moving into aesthetics, you kind of get to, there's a protocol, right? But there's also like the artistic component, the evolve of aesthetics and wellness that's coming into one, looking at somebody from an artistic lens and saying, you know what? I think that we should use this product. I think that we should look at this area, focus on this treatment. Is that what you're saying?
Yes, absolutely. We have so many products. We have so many techniques we can choose from. And that's what makes it really fun for me is I specialize in lips, right? Like people know me for doing lip filler. I love doing lip filler. And one of the reasons I love doing lip filler is because no set of lips are the same. Like everyone has a different shape, a different tissue density. And it's like with every person, I can choose a different filler to use. I can change my technique up. And I love that. I love being able to have that like artistic side and incorporate that into aesthetic medicine, because at the end of the day, we're still practicing medicine. These products are still medications. So yeah, it's fun.
Have you always had an artistic side of you?
If I showed you my drawings from like elementary and junior high, you would laugh. No, I'm not very good. I'm not very good. Even like for my kids, when they have a project, I let dad do the drawings and everything. So I never considered myself artistic. But I love beauty. I love a natural look. So I feel like I get to give that to my patients at least,
Well, I mean, shoot, I've seen your work. Your before and afters are amazing. I mean, you got to go check out her Instagram. It's top notch. She definitely puts her heart and soul into her work, and you can see that her patients absolutely love it. And I know that she has an amazing reputation and also an amazing retention base, meaning her patients continue to go back to her, right? Her and I were talking offline, and she's been able to build a really loyal practice. And I think, that's a big part of what the industry is really missing. We're always focused on new patient acquisition, which very important. You have to have patients coming in the door. You have to market. You have to be creative. I mean, shoot, being a practice owner and focusing on marketing, it's a serious job. There's a lot to do with all the platforms and channels. But I really, truly think where, the practice owners, and hang with me for a sec, guys, where you need to really focus your efforts is patient retention, patient outcome, patient experience. Because if they come see you, they like the result, they like who you are, they're coming back. They're coming back, they're telling their friends, they're telling their family, they're telling their colleagues. They're going to come back and see you versus you having to go spend the time and money to acquire another patient just so that another patient leaves you and goes somewhere else because they're not getting the results they're looking for. So that is one of the things that she's done incredibly well. And I want to pull back a little bit because you talking about urology and you being in this clinical environment, you've been in aesthetics, you said 7 or 8 years now, right?
Yep.
That when you're in urology, that was in Brooklyn, if I remember right? You were in New York.
Yeah, I was in Brooklyn.
Okay.
That's where I started.
Okay. You made this journey down to Miami, down to South Florida. That's where we're talking to you today. I want to know, and I know the audience wants to know, because I talk to a ton of practice owners that come from that type of background, not necessarily urology, but hospital, clinical, working in another practice. Talk to us about that journey. Like, there had to be some scary moments, right? There had to be a tremendous amount of adversity. Talk to us about that journey when you came in, you opened up your practice. Curious to know that story.
So coming from New York, I mean, I always knew I wanted to live in Miami. It was just like, since I was a child and I visited here, I loved it. So it was another just random recruiter reaching out to me. I don't know what's with these recruiters that just reach out to me. But they reached out and they said that they needed a PA in South Florida doing urology with a subspecialty of sexual medicine. That's what I was doing there. So I was like, okay, I mean, I can do that. And this can kind of open up the path to me moving down south. So I moved, I accepted a position, also same thing. So I was a urologist, and then he did some wellness. And then, I told him that I don't want to lose my aesthetic touch. Like, I still want to do a little bit of aesthetics. So while I was working full-time doing urology and sexual medicine, I was still practicing aesthetics on the side. So I would work 9 to 5 and then see clients 6 to 9, open up weekends, etc. And then eventually it just became way too much. I have 2 kids, I couldn't be working 2 full-time jobs. And my aesthetics practice finally started to grow, so much so that I could say, okay, let's just do aesthetics. Let's open up our own office. So I did that June of 2023. So 2 years ago, I formed Yanasthetics LLC. So it was an office. It was kind of like a suite where my eyelash tech, she was doing lashes, we had nails, and then I had this little room where I was seeing my patients. Still working full-time at the urology office, but now I have my own office where I'm seeing patients after hours. I quit my urology job October of 2024. So this was just this past year. I went all in to aesthetics. It was the scariest moment of my life when I was leaving. Everyone brought me flowers and everything, but I was crying, and I wasn't crying because I was so sad to leave. I was crying because I was just scared. I was terrified. You go from having health insurance and all these benefits and knowing that every 2 weeks you get a certain paycheck that's going to cover, X, Y, Z. And now all of a sudden I'm like, well, what if the summer months are really slow, or what if people don't come to me anymore, or what happens, how am I going to do this? And it was really, really scary. But it's like a plant, you water it, it's going to grow. So now I had so much more time to focus on building my brand and building my client base. I got a social media manager who was working on my social media. So I mean, it was the best thing I've done. I always say, I wish I did it sooner. I was so scared to do it because, me, I don't take risks. I hate taking risks.
You mentioned that, yeah.
Yes, I don't gamble. I need to know exactly how much I'm getting, how much I'm making, how much I have in my bank, etc. So this was a really scary step for me, but I would do it all over again a million times.
You know, whether you realize it or not, it's one of the best moves you've made. So I've seen the opposite of it. And I've seen practice owners see their dreams slip away from them, where they hear of this beautiful world of medical aesthetics, MedSpa, MediSpa back in the day. Can't even believe I just said that. But, you know, it was so vanity driven through social media, so attractive. And I think that there's this stigma out there still that's like, you see it on Instagram, it looks sexy, it looks attractive. By the way, there's a lot of money in it. And I feel like there's people that are getting into this specialty. They are putting their lives on the line, mortgaging their houses, getting loans, they unsophisticated loans, let's say, investment money from outside capital, whatever it is, friends and family money. They buy the expensive laser, they do the expensive build out, they overspend on inventory, and they go into this thinking it's just going to print money and put so much cash up front that unfortunately they realize that, wow, we don't have any patience yet. Right. And look, on this podcast, I've interviewed so many practice owners at this point. And guys, there is a theme. And Yana, there truly is a theme through success. And it's really just you focusing on your journey, you taking risk as you see fit for yourself, right? Very like you looking at this in the way of saying, hey, look, when I'm ready to do it, I'm ready to do it. But you had a patient base in a way. You had background in a way, right? You had the urology, then you have the aesthetics up in New York. You moved down to Miami. You built the aesthetics practice within that facility, right? So not only you figured out how to use devices, treatments, all that stuff. You learned the business in a way. Mm-hmm. And you had a base of patients, right? And then you go open up your own brand. Shoot, guys, this was less than a year ago that she's had her own practice. Less than a year. She's been doing it for 8. Okay. That's the difference. Is she knew how to take calculated risks that was right for her, that felt good for her. And even when she left, she said that she cried because she was scared, right? And dude, that's warranted. 100% warranted. Risky, and you have like so much courage. I love that. You go out, you build your brand, you build your thing, patients follow you. I bet you started making income month 1. Guarantee it.
So, like, just to speak on that, there were days, you have to block out all the noise, right? There's a lot of noise. Everyone's like, well, how are you going to do? Well, how much are you actually making? Well, what do your books say? And I don't know. I mean, I've never owned a business, I never considered myself a business owner. So when people said, well, what's your business plan? I was like, what does that mean? I had no idea. And it was like every single day I had to learn something. It's not just, standing there with a pair of gloves on and a syringe and injecting people. I had to actually learn the business side of things. And I'm still learning. Like, every week there's something, that I have to Google or ask ChatGPT or ask my colleagues. It's a really cutthroat industry in the sense that not a lot of people really want to help. Okay. And the ones that do, you have to pay them to help. Do you see what I'm saying?
Yep.
So one of my biggest challenges was, especially being new in Florida, I didn't have a mentor that was going to guide me on how to do this. I did it on my own, and so when you start, Googling and joining all of these like aesthetic provider groups, people start talking about numbers and you're like, oh my God, like I don't make that much. And it can be very unmotivating and, you feel like you're not good enough for something. I kept my overhead super, super low. I still don't own a laser. I still don't own a device. I have a microneedling machine, which is affordable, but I'm not ready to go and invest hundreds of thousands of dollars into a device that I'm not sure I can sell yet to my client base. And until I know I can, I'm not doing it, because why would I want to go, into negatives myself? Like, I'd rather pocket that money and live a better life
There
for
you
myself
go.
and my family. So I'm comfortable where I am doing what I'm doing. And people are constantly like, I have friends, even very close friends, that said, let me invest my money into your practice. Like, take my money, go buy what you need to grow your med spa. Let's get you a storefront. Let's get you this and this. And I was like, no, I don't want it. I don't want to have to explain myself to anybody of why am I not meeting the numbers if that happens, or why can't I pay it back? Like, I need to, again, like, don't want to take risks. I just want to take it day by day. And I'm sure one day I will get to that point, but I'm not rushing it, because I'm canceling out the noise. Everyone is telling me, oh, well, but you have to scale and you have to do this to scale. And I'm like, I'll get there. I'll get there
Yeah.
with time.
Good for you. I mean, you know how hard it is to block out the noise? You're constantly getting advice from sophisticated entrepreneurs and probably non-sophisticated. Like, you don't have to call out any names, but I'm curious if all this advice that you've received, you mentioned, friends, whatever, has any of it been from someone that has not opened a business or somebody that doesn't have a practice?
Yes. Yes. There's a lot of people that they have no idea what this industry looks like, but they are giving their...
They got all the answers? Yeah, they got all the answers, right?
All the answers. It drives me
Yeah.
crazy.
And that's so true for so many entrepreneurs, whether you're in aesthetics or outside, right? Like, I'm a real estate guy. I own quite a few rentals, and I've been buying real estate for 14 years. Man, that kind of ages me. Promise I'm not that old. But I will have people that come to me, still family members, are like, hey, that's a risky business. What if, the tenant doesn't pay, or what if, like, wow, that seems like a lot to do. And it's mostly from people that have never done it. People that haven't done it. I'm like, why are you giving me advice of something that you actually have never done? Or you're trying to guide me or tell me the downside of the risk, the upside, whatever it is, on something that you've never done when I've actually been doing this for like 14 years. Like, I'm just going to stump you, right? So I think it's interesting because everybody wants to, I think the intent is good, right? I think the truly is like the intent is good. Maybe sometime there's jealousy or whatever. But when it comes to owning your business, and this is for the audience, guys, you need to focus on you. You need to focus on what makes sense for you, because it could be one wrong move from from somebody that is not well educated in the craft, in the industry, understanding your journey, understanding where you are, right? And to her point, maybe somebody wants to give you money. Cool, that can sound attractive on the surface, but then maybe you have to answer to them, because if someone gives you money as an investment, they're going to want a return. That's how it goes, right? And so what you just said is like, I don't want to be accountable and responsible to you. I want to be accountable and responsible to myself. So I'm going to focus on my journey. And what you're saying, Yana, is I love hearing this, because most people, they will take the bad advice. They will listen to the noise. They will look at social media and say, well, she's here, I should be there. Maybe I should post this because she posted that. Right? And you've done a phenomenal job, no joke, of focusing on your success, your journey, who you are, and, being in this and having it for a year. Like, you don't know what's going to come in the next year or two, right? But if you continue to focus on every day, you're making progress, and you know that, right? And so as you are focusing on, you said you're an expert in lips and filler. You haven't bought a device, which I think is super wise, because you're just getting better at your craft. You are. Your patients love you. As you focus on that niche, let's call it, you're known for lips and filler, right? And your business will evolve and scale, and you know that. What do they love most about coming to see you? Because there's something special there, and I want to know what it is.
My patients are my friends. That's kind of how I designed it. Even my suite, it's like you come over my house. It's not just coming in and, it's like mundane paperwork and, let's just get to it. We talk about life. Like, I know a little bit about all my patients. Like, I set enough time to dedicate to each patient to get to know them. which is very different from, a lot of med spas,
Yeah.
where it's almost like a DMV, like one after the other, let's go.
What's your ticket number?
Maybe I'm not seeing as many patients per day because of just time constraints, but that's how I'm retaining those patients, So I love being able to connect with my patients. I do, the whole, even on social media, I do these outfit of the day posts, right? And the way that came about was because I love dressing up to work. I've worn scrubs for so long that I could not wait to finally be able to put on heels and put on something cute and do my makeup. And so every time my patients come in, they're like, oh, where did you get this? Where did you get that? Can you send me a link? So that's how it came about. I started doing these outfit of the day posts, and I get so much feedback on it. I get more feedback on those than I do on before and afters. So,
Wild.
I know. But that's what I mean. You just have to know your demographic. Most of my clients, I would say, are my age, which is so cool because we're aging together. So I'll get a text from a client on a Sunday morning of a selfie of her, no makeup, fresh out shower. Yana, what is happening? Why are we getting these shadows here? And I'm yeah, our faces are falling. I mean, welcome to your mid-30s. I'm there with you. I feel the same way,
Yeah.
And so we laugh together, and they'll be like, well, what are you doing? And I'm well, I started doing sculpture, and they're like, all right, book me in. I want to start too. So that's what I mean. We're more friends than very strict provider-client relationship. So
you build rapport with them. You know who they are. They're aging with you. You know your demographic. You have a niche. You focus on that niche. You connect with your patients in the sense of, these are my friends. These are my people. Mm-hmm. I mean, shoot. And what a job. So you basically get to dress up, get cute, put on a great outfit, show your girlfriends what's going on, go to work, chalk it up, deliver a result, and then go home to your family. I mean, that sounds like a pretty damn fun day.
It's fun.
Does it feel like work?
No.
Does it feel like work?
I love Mondays because I work weekends too. I do work Saturdays. I'll even open up one. I was just open this Sunday. I was posting because a patient realized she forgot to do sculpture and she's leaving for the summer to Europe. So, I mean, I accommodate for sure. That's another thing. You have to be accommodating when you have your own business. If you're a solo provider, that's another way that you retain your clients. But weekends are hard. I have 2 kids. They drive me crazy. And so when I come to work on Monday, it's not oh, here we go, Monday. I'm yes, I get out of the house. I get to speak to adults. It's not work. I'm just hanging out with my friends, and I happen to, enhance their features.
How many friends will you see a day?
I try to keep it at about 10. That's where I feel comfortable. I try to do about 10. There have been days where it's significantly less. Some days there's more, but I feel 10 is my golden number where I'm not overly tired. I'm not emotionally drained from having to interact with so many people, but
that's your comfort spot.
Every season is also very different, Winters are usually very busy before the holidays, so I'll open up my schedule way more around that time. Summers tend to be a little bit slower. People are traveling. People don't want to, stay out of the sun. So that's fine too.
So, okay. And I love it. So 10, comfort zone. And what I'm hearing, guys, and just to try to, reiterate this, is she has a niche. She's focused. She's focused on the patient experience. She builds rapport, documents the rapport, picks up on that conversation when you left off. When they rebook, are they coming back? How often are they coming back?
Depends what we're doing, but generally I see my patients every 3 to 4 months.
Every 3 to 4 months. Okay. And you pick up that rapport. They're aging. Obviously, you give them the advice on the aesthetic side. You guys pick back up. I bet they'd love to come see you too, because they get to have an awesome conversation, right? And so it's almost like seeing their therapist while at the same time, making me look younger and pretty, and just having a fun overall experience. And I think that's what people are buying, guys. They are not buying another syringe. They are buying look, get me out of my day to day. Maybe I don't get to have a fun job like Yana does every day. and I'm in the financial space, or I'm a burnout real estate agent, or I'm a stay-at-home mom, or whatever it is, like, holy shit, I have an appointment coming up. But they look forward to that meeting. They look forward to it. They know that they're going to get an injection of confidence, have a great conversation, right? And they're probably going to learn something new about aesthetics. If you're not teaching them something new about new treatment, technique, in the industry, whatever, you should, because they want to look at you as an expert. And then they're going to automatically want to rebook because they had fun. Like, they enjoyed it. If you have fun somewhere, you're going back. That's just how it is, right? And then imagine all the benefits on top of that. So, question for you. One of the biggest challenges you face, like early on, I'm sure, was taking that leap, right? When you took that leap to open up that practice, like, what gave you the courage? Like, there was this final moment. You're like, I'm doing it. I'm going. Walk us through that, because that's hard to do.
Yeah, it's hard. I think it's just like burnout more than anything else from your traditional medicine. I was working a lot. I felt like I was undervalued, underpaid. Medicine changed so much, again, over the last decade or two. We're being dictated, the insurance companies dictate what we do and how we do it. I hate being controlled. It's like,
you're a true entrepreneur.
I hate having a superior that I have to answer to. I hate having to explain things of why I'm doing what I'm doing. I was sitting on the phones all day with insurance companies, doing like deals and just getting prior authorizations on tests that I'm ordering. And I'm like, why do you need to know why I'm ordering it? I'm ordering it because I have a license to do so. This is what I've been taught. I've studied medicine long enough. I practiced it, this is why I'm getting it. But, it's all, at the end of the day, it's all about money.
Protocols, right? Money, protocols, process.
So I was just tired of that. And then, I was tired of, again, just, you have a boss, which it works for some people. I mean, there's definitely pros and cons to working for somebody and owning your own business, right? So There's headaches in both scenarios. But for me, it was just like, even, having like kids, right? I have 2 kids and they get sick all the time. That's just what kids do, apparently. And so having to ask for time off because my kid has a fever was driving me crazy. Like, and then feeling really guilty about it too. Like, I hated that. I hated that so much that I couldn't make it to my son's soccer game. And I was like, you know what? The only way that I'm going to be able to live the life I want is if I create it. And I had to create my own perfect job. So my perfect job is I get to make my own schedule. I don't have to ask anyone for permission to go to a recital. I see as many patients as I want. So if that day, I don't want to see 10 patients, so I won't see 10 patients, So that's the beauty of entrepreneurship, is that you get to control what you do and how you do it. And that's what I have longed for so long, and I worked to the point that I was able to do that. So I'm super grateful.
The upside risk outperformed the stagnant stay of security, basically, right? You're like, hey, I could stay here. I could be on the phone with the insurance company and answer all their boring ass questions that they know the answer to. I know the answer to. It's just protocol, let's call it. Or I can leave. You can always go back. You can always go back. Hey, if this fails, I can go back, whatever. But you got sick of it, sounds like, right? You got sick of it. You wanted to build your own job. You wanted to build your own lifestyle, which, man, that takes so much resilience and tenacity. Like, really, kudos to you. This shit's not easy. Being an entrepreneur is not easy stuff. I have 2 kids myself. I totally get it. Look, and you know what? Just some advice for practice owners out there. If you have providers, let them, like, in front desk, staff, all that stuff, let them enjoy their lifestyle. Like, they will respect that forever. Give them the freedom to like take care of their family, go to their recital, the soccer games, stay home. Shit happens, life happens. And I was actually listening to a podcast earlier. It was Dana White, the UFC guy. And he was talking about this exact thing. He goes, you know how many people leave other companies because they're locked in a box and they don't have the ability to have freedom with inside the company to like if to go to the kids stuff? He's like, if you have a kids event at the UFC, and I know this is a little off topic, but it kind of goes back to what you're saying, you're required to go to it. And he's like, that culture shift has changed our entire foundation, and people want to work with us versus us putting them in a box. You know, so that's just some advice for practice owners and business owners that are tuning in. But for what you said, you're like, you know what, this isn't going to work. I'm going to go build my own lifestyle. And I got the courage to do it. So guys, it's not easy. And I think like you have to take the jump, the leap of faith, believe in yourself. Like one thing that's always worked for me is I've bet on myself. And I know Yana's done the same. She bet on herself and it's obviously working out. So pivoting just for a second, right? Looking back, is there a decision that you made, like maybe one that felt risky, unconventional, something that ended up transforming your business? So as you opened day one, going into 90 days, 120 days, 6 months, was there one thing that you saw early on that kind of stands out that you're like, okay, I absolutely have to do this to shift or to, I don't necessarily want to use the word scale, but adopt and make it more proficient at the practice?
Definitely hiring a social media manager.
Okay.
It's a full-time job. Like for me, that was really difficult because I can take all the content photos while I'm seeing the patients, etc. But it was like taking away from my time at home after hours at night, where I had to actually put the images together, maybe pretty before and afters, hashtags, all of this. Like that's a whole like different field that no one trains you in, you know. Like I'm, you know, generation of like Facebook, MySpace,
Instagram, I love it.
Yeah. And now all of a sudden everyone's like, you got to do TikTok, and I'm so overwhelmed. I'm like, TikTok.
Oh gosh, another app.
To start dancing in front of the camera. I was like, what? Fingers here. So it's just, there's so much to social media, but realistically, like you have to do social media nowadays. You know, you have to. There's no other way around it. And believe it or not, my social media looks great, but I die a little bit inside every time I post myself doing a reel. I hate doing it. I'm so uncomfortable in front of the camera. I don't enjoy doing it. So getting a social media manager, she is so amazing. I just give her the content. You know, sometimes she comes to my office, she'll shoot the content, and she does everything. And now I have so much more time to focus on other things. And it's just, you know, it took a whole weight off my shoulders, and I definitely recommend it. And it took me a long time to agree to having someone manage my social media because, again, control freak. I was like, no, I can do everything on my own. I don't want anyone touching it. You don't know my style. You don't know what I like. And so, yeah, sometimes I probably drive her crazy because, you know, I'm like, oh, can we just fix this little thing? Or I don't like this word, you know. But I love her because she still lets me, you know, a lot of input from my end coming in for her. She takes into consideration. She changes things up for me. But I recommend everyone have a social media manager. It was worth it 100%.
So that was probably something that you held on to for a while, didn't want to delegate. Mm-hmm. And finally took the leap of faith, and that saved you time. So you bought some time back. Yeah. Right? You still have some control, get to put your aesthetic appeal on it, if you will. But now you have a resource that you can delegate that to, focus on your next patient, your journey, business, maybe time back with your kids, family, whatever it is, which I think is super, super important. And you made a point that you should have done it sooner. Mm-hmm. I would agree with you on that because a lot of times, guys, as business owners and entrepreneurs, we like control. That's all of our personality. Like literally, if you've opened up a business, you like control. You like to be in charge. You like to be, the image of your domain, if you will. But if you don't start to realize that delegating activities like administrative work, if you do that earlier than later, because you will buy your time back, right? And I know it's hard. It's hard to pass control to someone else because you're never going to trust them as much as you trust yourself, right? And so I agree with you there. And then you made another really good point that was every time you post something, you die a little bit inside. I think like you're so honest. Like I love how honest you are because I think a lot of us feel the same way. It's almost like, oh, is this even me? Like, why am I posting this shit? I feel that way. Honestly, it's a job. It's kind of a task. It's a job. You have to get it done. And the power of social media is it gives you the ability to connect with people throughout the world with the click of a post. And people can see your work. They can see your personality. They can see who you are, and they can connect with you. And ultimately, if you're a practice owner, they'll book you. And then you become, I bet people that you've met through social media, you never thought you would. And now they're your friends, they're your clients. Right. So it's a tool, but I get it. It's, dancing in front of the camera with TikTok. What's next? Like, geez, give us another platform. That's all we need. My gosh. So, just to double on that, guys, delegate the responsibility, invest in social media, and you also connect on your demographic very well, right? Because you're not from the U.S.
No, I was born in Russia.
You're born in Russia. So I would bet that you connect with that Russian demographic. I'm sure you have clients that you relate to. Is that fair to say? Or
yeah, for sure. So I live, I'm in Aventura. We have Sonyals right here, which is, very Russian, Ukrainian speaking neighborhoods. So I definitely see a lot of patients from that, region.
That makes so much sense. I mean, they want to see somebody that they are like connected with.
Yeah. A lot of, especially with everything going on overseas right now in those areas, we had a lot of people migrate here, and a lot of them don't speak English, so it's nice that I'm fluent in Russian, so I could speak to them, and I find that I get a lot of referrals just because of that.
Now you got to say something in Russian for me.
Что тебе сказать?
What is that?
What do you want me to say?
Something MedSpa specific.
I have to think about that one.
Okay, come back to me on it. That's all good. Oh my gosh, that's amazing. So I know you're super busy. I know you got a patient coming. Actually, I think you said about 15 minutes. Yeah. But okay, I got two more for you, but we'll make it quick. Mm-hmm. The aesthetics and medical aesthetics, wellness, elective world, it's changing fast. I mean, it's changed fast in the last year, 2 years, 10 years, like completely different. As it's evolving so fast, like how have you personally or professionally had to like stay ahead? What are you doing to stay ahead and just be forward thinking?
You have to go to conferences. That's one thing that I will say is there was a time that I wasn't, and that's when I felt like I started to get behind. There were a lot of new, techniques, products that I didn't even know about. And now I definitely make it a priority. I try to travel, or go to local events. Just this past week, I went to 2 dinners, where I learned so much. You have to. That's how you're going to network. You're going to meet people. I mean, I met you at, just recently at the Top 100 cruise.
Yep.
So you have to go, and that's where you're going to stay ahead because you're going to learn about things that are up and coming, and so you could be the first one to incorporate it into your business.
100% agree. I've said it on so many of my episodes that conferences, networking, your net worth is your network. Like there's so much truth to that. As the business continues to scale, evolve, change, wellness has taken a massive leap into the industry. And I think like biohacking now is also, so it's going to continue to evolve. So I completely agree. networking and conferences is absolutely key to continue to staying ahead. Last one for you. There's other females and dudes, if you will. I'll call them dudes, that are looking to open up a practice, maybe looking to get into aesthetics, looking to leave a practice, go open up their own. Maybe private equity wants to come in and invest as well. Like, what advice would you give someone, and maybe specifically women, looking to follow your footsteps, like to build a thriving practice or business in this industry? What advice would you give them?
So first and foremost, I get a lot of messages from people in school, and PA school and P school, saying, well, when I get out, I want to do exactly what you do. And I say, don't. Don't do exactly what I do right off the bat, because there's so much, you need to kind of lay a foundation in medicine, I think, to be good at aesthetic medicine. You have to learn true bedside manner. That's one. You have to know your basic, medicine, anatomy, physiology, etc., to understand how things work. And I think that you will appreciate being in aesthetics so much more once you've actually practiced medicine, in a hospital setting or wherever. So you can't, people think this is like a get rich quick, way to get rich quick, I guess. It's not. It involves a lot of investment, a lot of time. So when you graduate, go practice, whatever it is that you want to practice, whatever specialty you want to do, and then start doing aesthetics slowly. You have to, it's not something that you can just go all in with right off the bat. So like what I was doing, where I was doing it on the side for a little bit, Yep. You can't continue doing it on the side for the rest of your life. It's not a side hustle. It's a side hustle very temporarily.
Got it.
And if you're any good, it's going to be even more temporary. Like the amount of time that you're going to be able to keep it as a side hustle is very short. So once the clientele starts building, that's when you can already start considering entrepreneurship and opening up your own space and all of that. And it's not for everybody. I know people who did what I did and then said, I don't want to do this anymore, and went back to working in a MedSpa.
Interesting.
Working under somebody who's going to take care of the inventory and the advertisement and the marketing and the social media and all of that, because it's not for everybody. It really is a full-time job. Like I always laugh, like I gave up a 9-to-5 to work 24/7. 24/7. And it's a lot. There are days that I'm like, I just want to shut off my phone, I'm on vacation. Why am I still, I have 2 phones, right? So, and I'm just like,
no joke.
I look like a drug dealer everywhere I go. One of them is always going off. And sometimes you really just want to disconnect. And I think that the only time you can really disconnect is if you don't own your own practice. So if it's really important to you that you don't want to work as much, then maybe this is not a path you should be taking. But if you're someone like me who doesn't mind putting in the work and doesn't want to answer to anybody higher, then it's the best thing that you can do. So you gotta
prepare to put in the work.
Yeah, you have to figure out what means more to you, what matters more, and how much work you're willing to put into it.
So funny. I'm with you right there. I think a lot of people think like, hey, I'm gonna go open up my own business, my own practice, because I don't want to work 9 to 5. And it's like, okay, good luck. Shit. There was a time when my business was just beyond busy. I was getting up at like 2:30 in the morning. I would crank till about 6:30. This is 4 hours. And then I'd go to the gym. And then I'd come back and crank. And, my eyes would probably just get to sleep, like 10, 11:30, something like that. And I did that. I ran at like very high RPMs for a long, long period of time. And not a whole lot of people can do that. Mm-hmm. You have to be driven. You have to be inspired. You have to want to do it. You have to have a why behind what you're doing, or else you will burn out. I can relate to that in so many ways. And if it's not for you, like, that's all good too. Doesn't mean that you failed, right? It's like, there's a lot of wonderful intrapreneurs, providers that work within a medical aesthetics practice that are great producers that they want to show up, inject, go home. I get it. That doesn't sound like a bad lifestyle either, right? So I really appreciate you saying that. Okay, guys, she's got to get to a patient. She's super busy. She's out of South Florida. She's one of the top 100 injectors, nominated by colleagues. Connect with her. She's got a great story. People DM her, people hit her up. If you're a patient, have a patient in the area, send them to her. She has incredible results and obviously has a very amazing way of connecting with her patients on a special level. So if they want to connect with you, find you, see you, what's the best way for them to find you, Yana?
Instagram at Yanasthetics. You can go on yanasthetics.com. I'm on Facebook, Yanasthetics. TikTok, Yanasthetics. So pretty much any channel you'll be able to find a booking link. You'll find a phone number, an email, whatever you prefer. You could text me literally anytime.
That's Yanasthetics, guys. Go check her out. True class act here. So thank you so much. I appreciate the time. And guys, if you found this particular episode valuable, if you like what you heard, like what you saw, my only ask is you share it. Let's share it. Give some shout out, give some love. That's my biggest ask. We just do this out of the kindness of our heart, want to give back. So I appreciate having you on. It's been an amazing conversation. I'll let you get to your day and your practice, and I'll leave it at that.
Thank you.
Until next time.
Cameron, thank you.
You're welcome. Happy injecting.